Today I'm going to talk about pancreatic cancer. Pancreatic cancer is a disease which, although is not in the top 10 cancers in India, but it's a very deadly disease because it's the seventh leading cause of mortality around the world. And even after proper treatment, we see that the 5-year survival is almost less than 20% in these diseases. There are various reasons for this. The main reason is that it usually only about 20% of the patients present to a physician or a doctor in time for a curative treatment. 80% of the patients appear late when they are already the disease has spread beyond the confines of the pancreas. So the common signs and symptoms of pancreatic cancer, most cases will have very non-specific symptoms like weight loss, loss of appetite, or some pain in abdomen. Because the pancreas is located very deep inside our abdomen, usually the pain is not very localized, and it comes across as a diffuse kind of a pain. And it's very easy to miss out these symptoms and just treat it with over-the-counter pain medicines. Sometimes pancreatic cancers may present with jaundice. Sometimes they may also present with black colored stools, which basically means that there is some bleeding happening from the pancreas. And sometimes it may present with a new onset diabetes in someone after the age of 50s or 60s. Sometimes it may also present as pain in abdomen, during which case when we do the testing, we find out that there is a cancer in the pancreas. The diagnosis usually starts with a ultrasound of the abdomen, but since again the location of the pancreas is such that it usually requires a CT scan or an MRI of the abdomen to diagnose it more accurately. Sometimes when the difficult to understand lesions, we may also have to do an endoscopy, and in more advanced cases or more difficult to diagnose cases, we may require an endoscopic ultrasound. Now, once it is diagnosed, and sometimes biopsy is not required for diagnosis, only the imaging features like the endoscopic ultrasound features or the CT or MRI features can tell us with a high degree of certainty that we are dealing with a pancreatic cancer. Now, the treatment of pancreatic cancer are three modalities, as with all cancer treatments. The main part of the treatment would be surgical excision of the tumor, then chemotherapy and radiotherapy. The surgery, there are mainly two types of surgeries that is done in pancreatic cancers. The cancers which are depending on the location of the tumor in the pancreas. If the cancers are located near the head of the pancreas, then the procedure or the surgery that is done is known as a Whipple's pancreatoduodenectomy. Basically, it means removal of the head of the pancreas along with the surrounding structures. Sometimes the tumors are located in the body or tail of the pancreas, in which case we have to remove that part, which is known as a distal pancreatectomy, and sometimes we have to also remove the spleen along with it. So these surgeries can be done in an open manner or also can be done in a robotic or laparoscopic manner, which entails a shorter hospital stay and probably a better or a faster post-operative recovery. As far as chemotherapy is concerned, the chemotherapy can be systemic chemotherapy or it may be targeted chemotherapy, where depending on the certain markers of the pancreas of the cancer, we may have target molecules, which we may have chemotherapy to target specific molecules which will prevent the tumor from growing or spreading, or maybe even getting new blood vessels. And the last thing is the radiotherapy, which is also important before or after surgery, which helps in controlling the disease locally. So with treatment with certain type of pancreatic cancers, we may achieve survivals upwards of 50% in the next 5 years. But the most important thing is presentation on time. So a high degree of suspicion is a must in diagnosing and treating successfully these very dreaded cancers. Thank you so much for your attention.